Or you can, yes.
I'm in the same boat.
It's on reactions on the bottom, but you have to take it down.
Got it.
Okay.
Madam Chair, I am on my phone, so I will just register verbally that I am in support.
Thank you. Okay. All right. So what we're saying is that the members of the Radiologic Task Force support initiatives that provide student loans and tuition assistance to individuals pursuing careers in radiologic technology, nuclear medicine, and respiratory care. So these are just talking about, and I can revise this. So this is just talking about those Connecticut Horizon Grant as not ensuring that those financial barriers don't prevent them from entering these high demand areas. Thank you. So recommendation 1 passed. Recommendation 2 is about loan forgiveness and expanding the program for the Connecticut Student Loan Repayment Program. And I do understand the current climate that we're in right now, but this is a recommendation on the table. So recommendation 2, do I have any support for this?
Yes.
Okay, do I have a second?
Second.
Thank you, Shadad. Okay, so we are, go ahead and if you can just give me a hands up for those in favor. Okay, so we will go ahead and move forward with recommendation 2. So recommendation 2 is the members of the task force support implementing or expanding loan forgiveness programs such as the CSLRP for healthcare professionals to commit to working in underserved areas or in the state of Connecticut. So that will help to alleviate our critical shortages in the essential roles. Thank you. Recommendation 3, to remind you, is about grant funding. So this is asking for the world right now. So we're going to ask for the world here. So do I have any motion to move forward with recommendation 3?
Motion move forward.
Thank you, Mr. Green. Any second?
Second.
Thank you, Shazad. All right, all in favor, hands up motion, please. Okay, so we will move forward with recommendation 3 for grant funding. So again, this is going to say that we do support and allocate grant funding to individuals pursuing careers in our various fields. So helping to enhance our training programs, pay our clinical instructors, and provide resources that ensure growth and retention of a skilled healthcare workforce. Recommendation 4 is recruitment. So this is HOSA. So just as a reminder, this is where we are right now. So we are, I'm looking for a motion for recommendation 4. Do I have anyone for a motion?
Motion.
Thank you, Dr. K. Second?
Second.
Thank you, Shad. All in favor, hands up motion, please. Okay, we will go ahead and move forward with that recommendation as well. All right, and our last one was the one that got the most discussion, I think. So our compact licensure. So this is recommendation 5 and the final one on our list. Do I have a motion?
Can we kind of talk about this one more time for a minute?
Sure.
I'm not against it. I'm
sorry, procedurally, we to discuss it, if in a voting item, we need a motion and a second, then we can discuss.
Okay.
Just to be,
yeah,
procedurally. So I'm happy to move it for discussion.
Okay. Do I have I'll second that for discussion.
Thank you.
You're welcome. All right. So let's go. And all in favor
of discussion?
No, I'm sorry, Madam Chair. Just at this point, this just then gives us an opportunity to discuss whether or not people want to move forward with this.
Okay, thank you. Go ahead, Ms. Griffiths.
So I'm wondering, is this something that is recommended that we, and this is really for Senator, I apologize, I'm probably McCahey-Vahey. Is this something that you feel like we should be recommending at this point, or is it something that's going to come up anyway? I'm not sure if would it muddy the waters with our other recommendations? Is it better to stick to just a few? I guess I'm not, I don't want to recommend it and have this be passed and not some of the other ones. Yeah, please.
Senator. Yes,
Okay,
Representative.
thank you. So one of the things about the other recommendations are their fiscal costs associated with those. Anything with a price tag is often more difficult to pass. The compacts that we have passed, it's a very limited, if no cost actually, to the state. But what I would say about this recommendation, and my other meeting has now ended, so I'm able to focus more clearly and specifically. They're specific, and what I don't know in this recommendation is which exact compact that recommendation would be for. You know, for example, and does a compact exist or is it in process? And I will give you an example with the social workers. We went forward with passing the social work compact, but the compact was in formation. So we had people from the Council of State Governments, the Defense Department, the National Association of Social Workers, people locally in Connecticut, all of whom had been working towards the compact and had very clear directive on it. In this case, I'm not sure, exactly what the recommendation is for which specific compact. Do those exist already and Connecticut simply isn't a member? For example, those are some of the questions that I would have. So in some regards, for me, as I think about it as a chair, if we were to move forward with any legislation, we would probably need more details to be able to know specifically. I also will just reflect, I heard in the conversation earlier that there was some hesitation and ambivalence. Again, the kind of work that you all do, it's not largely telehealth, for example, or there are some pieces that are a little different. Not to say, obviously, nursing. We did do the nursing compact. That's existed for a long time. Lots of hands-on work with nursing as well. But I just raised some of those as issues for consideration as we enter into this discussion.
Thank you very much. Ms. Griffiths?
Do you feel that it would be something that could be passed or could be worked on in our different organizations where we get more information, we find out a little more about it, and we have specific compacts with certain states, as opposed to a group, as opposed to a recommendation from a task force that is really 3 professions? And I think maybe potentially makes it a little more complicated.
So it does. I think the specificity is probably more helpful. And just because this group doesn't recommend, if there is a recommendation that was coming from another group, we certainly can consider that as potential legislation. I will say the one thing about compacts is they are weighty in terms of the actual writing of the legislation. So we tend to not do more than one in a session. We did have an occasion where we were able to do 2, but just because of some workload issues. But all that to say, the real answer to your question, Ms. Griffiths, is that if the group today decides not to move forward with this recommendation, that doesn't preclude any other group or society or organization from bringing forward the recommendation to the committee.
Okay, thank you. That's helpful.
Are there any further comments or questions related to this recommendation before we move forward?
Can I just, what is the actual wording? Because the other ones we've had this slide up, and then once we vote, we move on to the wording. Can I see the wording first?
Sure.
Thank you.
Mr. Green, did you have a comment that you'd like to?
I think going back to what Dr. K was saying, I think it's sort of a philosophical thing that we want to, as we present, that we can disagree on this, but I think we're on the same page that, you know, compact licensure really helps people that want to move in and out of states that probably aren't going to be long-term solutions for the workforce. So, you know, I'm not either for either one, but I think maybe we need to make a decision. Do we want to make a concerted effort to roll out all the recommendations as these are the long-term fixes, and this is what we look for to shore this up for the state of Connecticut, and leave the travel out of it? Because I mean, Dr. K is right, and Karen, you're right as well when you talk about what the other hospitals are saying. You know, travelers are not as invested. You know, they're not as empathetic to our patients. You know, they're kind of there for the money. So they fill that double-edged sword. They fill a need of the body being there. But do we want to decide as a, you know, a committee and a task force that we don't want to look in the short term, that we want to steer our document and our recommendations to fixing this, you know, more long term?
Mr. Green, I couldn't agree with you more. I think you were right on when you said that this is more of a short-term fix than it is of a long-term solution for the current shortage. So I will go to Representative McCarthy-Vahey.
Thank you again. And again, just for consideration and discussion purposes, I hear what you all are saying about travelers. I was in and out of the conversation earlier, so I didn't hear it in its entirety. But I will say the other piece of the compact conversation that we've had with every other profession is also when we have people moving in to Connecticut, which we, for the past 3 years, have had positive population trends. As a military family member myself, we, you know, do have the sub base, for example. So those are some of the things that we have considered as we've talked about compacts, is when you do have trained professionals who are moving and able to just, you know, jump in a little bit more easily. You know, the compact requirements, Connecticut would have to agree to go forward with them. And I think the only, you know, real question that I have is, unlike some of the other compacts that we've gone forward with, and my hesitation in wholeheartedly saying, yes, we should do this, is I don't know a lot about these compacts and what potential barriers that we might need to overcome. For example, we had a lot of conversations related to the nursing compact last year. So I'm just recognizing the ambivalence, but also trying to say, I think there are pluses as well.
Thank you. Ms. Griffiths.
So our state professional organization is pushing for compact licensure, and I know they're working on that separately from this committee. I don't know the ins and outs of it. I know that there are certain states that they're working on. Sajad is actually on the board and may have more information as far as respiratory and where we are as far as that. When I know we're not in the voting stage right now, when we vote, I'm actually not going to vote for this at this time, not because I don't think it's potentially a great way to fill the short-term shortage, as Matthew was saying, but more because I feel like it's just going to complicate things, because we don't have enough information from each of the three professions on exactly what we need to do to push for this. I think if it is important to the professions, we should each work on it, but maybe outside of this, this task force is kind of my feeling on that. And Sajad, do you have any other information for the respiratory compact licensure that has been discussed at the respiratory board?
We were supposed to have that meeting today, but not only is it after this one, but it also got postponed because that's what they're going to be discussing, I think, at our national conference that's taking place right now.
Okay.
So at this time, I haven't gotten any updates.
Okay, thank you.
Okay, thank you. So I can tell you I don't know of any compact licensure that exists in radiologic technology or nuclear medicine technology. So that I don't think is something that we've pushed for at the state level. Any further discussion? do we want to move forward with this recommendation? So I'm going to move to voting. Okay, so recommendation 5 is about interstate medical licensure compact and similar compact licensure agreements. Yes. Representative McCarthy Bay.
So sometimes as chairs, we don't, in our committee, put things up for a vote unless we know we have support for that. And it sounds like we're not sure how this vote will be. There are, the group doesn't have to take a vote on this item. You can take no action on it if you would like to do
Okay.
that. So if people would prefer not to vote, you can withdraw those motions and not vote. I think the discussion here is really important for me, at least as a co-chair of public health, to understand that there is ambivalence, that it may differ among professional groups. And given that the recommendation is for all three, it might make sense to hold on that. That's just a thought, but obviously I defer to you as the chairs.
No, I appreciate that. Thank you so much for your thoughts. I would, and we've talked about this during the sub-working group, right? So when we met, it wasn't something that the three of us really fell in love with, but it was something that we thought it was important to move forward because one of the groups felt it was important or they're moving in that direction. So I would like to personally do no action on this. So I just want to make sure that we are in agreement with the 4 recommendations that we're moving forward with and then just leave this as something that's there, but not one that this task force is willing to take on in our final report. Mr. Green?
Yeah, I agree.
Okay.
I agree as well.
All right. Thank you. All right. So what we have is we have 4 recommendations that we're going to move forward with. So those 4 recommendations, again, are going to be about the student loans and tuition assistance, the loan forgiveness expansion, grant funding, and then also our recruitment and marketing support. So the next thing that we've got to do is we've got to actually write the report. So this is something that Mr. Green, Ms. Griffiths, and I will work on we'll work on our separate areas and then bring them together in a final report. So I do appreciate everything, working together to be able to enact the changes. Our next meeting is going to be scheduled for December 12th, and I think we agreed on 10:30 a.m. You should have already received an invitation. The report, a draft, will be sent to you prior to that time. So Ms. Griffiths and Mr. Green will be working on their portions. We'll collect them together and put them in one final report as a draft to present. Any additional comments or questions? All right. So I think, thank you so much, everyone. Do I have a motion to adjourn?
Motion.
Dr. K and then Karen.